Vagus nerves supply many of our organs. In this video, we focus on those branches of vagus nerves that from cardiovascular center in medulla oblongata send signal to the heart. Cardiovascular center would be groups of neurons that we have in medulla oblongata. We know that medulla oblongata is the most inferior part of the brain, the part that is fused to the spinal cord. Vagus nerves exit from medulla oblongata, so they are cranial nerves. And let's note that in vagus nerves, we do have parasympathetic axons. Clearly, we know that parasympathetic nerves are firing signal to help us either stay at resting and digesting situation or go back to the resting and digesting situation. When we follow vagus nerves, we see that they have their branches mainly supplying sinoatrial node and atrioventricular node. Clearly, when we say vagus nerves mostly communicate with SA and AV nodes, it simply means that vagus nerves have the most impact on the heart rate. So let's see. When vagus nerves fire signal toward the cells that we have in SA and AV node, the result would be decreasing the heart rate because the molecule released from vagus nerves near these nodes would inhibit the cells that we have in SA and AV nodes. And we know when heart rates start going down during resting and digesting, obviously that also impacts the cardiac output. It helps cardiac output to start going back down toward the resting cardiac output. However, we know when we are at resting digesting or when we want to go back to resting and digesting, stroke volume also decreases. Stroke volume starts going back toward the resting stroke volume. The main explanation for why stroke volume during resting and digesting situation basically goes down, decreases, is because during this period of time, the sympathetic nerves, cardiac accelerator nerves, are not going to stimulate the myocardium of the chambers. And speaking of the ventricles, when cardiac accelerator nerves are not stimulating the muscles here, obviously the forcefulness of their contraction decreases, myocardial contractility decreases, which that leads to a decreased stroke volume. So I emphasize one more time, when you follow the branches of vagus nerves and you see that mostly vagus nerves supply the nodes, it simply means that what you expect from vagus nerves would be decreasing the heart rate. Vagus nerves have little to no impact on the myocardial contractility and stroke volume. Then we take a look at the end of vagus nerves and we notice that vagus nerves release a neurotransmitter molecule named acetylcholine, and we already know that acetylcholine is an inhibitory neurotransmitter for the cardiac muscle cells. Acetylcholine in the sarcolemma membrane of this cardiac muscle cell looks for receptors named muscarinic receptors. And when acetylcholine binds to these muscarinic receptors, there are different explanations why the cell is inhibited. I included one of those explanations here. One would be because the potassium ion channels open, and due to outflow of potassium ion, cell becomes inhibited. So that's the main reason we say acetylcholine, by binding to muscarinic receptors in the membrane of cardiac muscle, manages to inhibit the cardiac muscle cell.